Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Have you ever considered how vital it is to understand first aid for blunt trauma? Blunt trauma refers to injuries caused by an impact with a dull or flat object, often resulting in bruising, fractures, or internal injuries. It's a common occurrence in everyday life, from minor accidents at home or work to major incidents like car crashes or falls. Knowing first aid for such situations can be a game changer. It's about more than just being prepared. It's about potentially saving lives, minimizing the severity of injuries, and providing immediate relief to a victim until professional medical help arrives. This knowledge is not exclusive to healthcare professionals. It's something that each one of us can learn and utilize. It's about empowering ourselves to be proactive, to step up when it matters the most. Recognizing the importance of first aid for blunt trauma is the first step towards making a difference in an emergency situation. Understanding what blunt trauma is forms a foundation for effective first aid. So, what exactly is blunt trauma? It's a type of physical trauma that occurs when a body part collides with an object, leading to a concussion, contusion, abrasion, laceration, or fracture. It's different from penetrating trauma, where an object pierces the skin. Common causes include falls, motor vehicle collisions, assaults, and sports injuries. These incidents can result in a wide range of injuries, from minor bruises to life-threatening conditions such as internal bleeding. The severity of the injury can depend on various factors such as the force of impact, the area of the body hit, and the overall health of the individual. It's important to remember that even if an injury looks minor on the surface, it could be more serious underneath. With this understanding of blunt trauma, we can now proceed to discuss how to administer first aid effectively. Administering first aid for blunt trauma involves a series of clear sequential steps. Our first priority is always safety. Before rushing in, we need to ensure the area is safe for both ourselves and the injured person. If the area isn't safe, we must move the injured to a secure location if it's possible without causing further harm. Once we've established safety, we check the person's responsiveness, gently tap them and ask if they're okay. If they respond, we can proceed with first aid. If they are unconscious, however, we must immediately call for emergency medical assistance. Next, we assess the person's breathing. If they're breathing, we place them in the recovery position to maintain a clear airway. This position is on their side, with their head tilted back and their bottom arm reaching across to support their head. If they're not breathing, we begin chest compressions and rescue breaths, also known as cardiopulmonary resuscitation or CPR. Push hard and fast in the center of the chest and follow with 2 rescue breaths. We repeat this cycle until help arrives or the person starts breathing on their own. While waiting for medical help, we can also manage pain and prevent further injury. If possible, elevate the injured area and apply a cold compress to reduce swelling. Avoid moving the person too much, as this may worsen their condition. Now, it's crucial to remember that all these steps are meant to be temporary measures. They're not meant to replace professional medical help, but to keep the person stable until that help arrives. As soon as you can, call for emergency assistance, and if you're unsure at any point, ask for guidance. These steps may seem daunting, but remember, in a blunt trauma situation, every second counts. Your quick thinking and actions can help save a life, so stay calm, stay focused, and follow the steps. Following these steps can make a crucial difference in a blunt trauma situation. Let's take a moment to recap the essential points we've covered. We began our journey by understanding the importance of knowing first aid for blunt trauma. We learned that such knowledge is not only essential, but also life-saving, as timely intervention can prevent serious complications. Then, we delved into the nature of blunt trauma, exploring how it differs from other types of injuries and the potential dangers it presents. We stressed the need to recognize the signs of blunt trauma early to ensure effective first aid. Next, we walked through the step-by-step process of administering first aid for blunt trauma. We emphasized the importance of staying calm, ensuring safety, assessing the situation, and seeking professional medical help as soon as possible. Each of these elements plays a crucial role in managing blunt trauma effectively and potentially saving a life. Remember, your knowledge of first aid for blunt trauma could potentially save a life. Stay prepared, stay informed. UMCC Medical Consultant Connectors, your ultimate consultants on matters healthcare. Kindly subscribe, like and share.